Now next up, we have catecholamine synthesis as well as tyrosine catabolism. And if you notice, we have the same pathway that we covered when we discussed the amino acid derivatives. The catecholamines, which include dopamine, norepinephrine, and epinephrine, are the hormones that are derived from phenylalanine. And the first step in catecholamine synthesis is the conversion from phenylalanine to tyrosine via the enzyme phenylalanine hydroxylase. Now this step requires tetrahydrobiopterin as a cofactor. And while we're on it, if phenylalanine hydroxylase or tetrahydrobiopterin are significantly decreased, what disease do you think you would get? There you go, that'd be PKU. Now after tetrahydrobiopterin is used in this reaction, it is reduced to dihydrobiopterin. Then dihydrobiopterin reductase is used along with NADPH to restore dihydrobiopterin back to tetrahydrobiopterin, so it can be used again. And speaking of NADPH, what disease results from a decrease in NADPH synthesis and can ultimately lead to red blood cell destruction and bite cells? Well, this is the highly tested, high-yield, all-important disease of G6PD deficiency, where the enzyme glucose 6-phosphate dehydrogenase is defective or deficient. Now the second step in catecholamine synthesis converts tyrosine to dihydroxyphenylalanine, or DOPA for short, as you can see here. Now this step requires the enzyme tyrosine hydroxylase, and again it uses tetrahydrobiopterin as a cofactor. And while we're on it, can you think of an inhibitor of tyrosine hydroxylase? There you go, that's tyrosine. And this drug prevents the conversion of tyrosine to DOPA, and therefore decreases overall catecholamine levels. Now this step is very similar to the previous step that we just saw. It just uses a different enzyme. Now tyrosine can also be converted into homogentisic acid, and eventually into fumarate, which can enter the TCA cycle. Now this process can be disrupted if homogentisate oxidase is deficient, which is involved in the conversion of homogentisic acid to myl acetoacetic acid. Now this will lead to a buildup of homogentisic acid within tissue and cause bluish-black skin and cartilage pigmentation, as well as cartilage destruction, leading to severe arthritis. And with all that said, can you think of the name of this disease? Great, that's alkaptonuria, which is due to a homogentisate oxidase deficiency. Now, in our third step, DOPA is converted to dopamine, which requires vitamin B6 as a cofactor, and DOPA carboxylase is the enzyme here. Now this step is inhibited by carbidopa, which is used to treat Parkinson's disease. And as you'll see in the neurology section, having too little dopamine can lead to some of the symptoms seen in Parkinson's disease. And do you know why a drug that actually inhibits dopamine synthesis actually helps patients with Parkinson's? There you go. That's because it only inhibits the reaction outside of the blood-brain barrier, in the periphery. This allows more DOPA to be available in the brain for conversion into dopamine, and therefore will lead to higher levels of dopamine within the brain. Now DOPA is also converted into melanin by tyrosinase. And if this enzyme is defective, which type of cancer would the patient be at increased risk of developing? Great, you've got it, skin cancers. Now if tyrosinase is deficient or defective, you don't develop any melanin, and therefore you'll develop albinism, and this will place you at an increased risk of developing skin cancer. Now back to our catecholamine synthesis pathway, dopamine is converted into norepinephrine by the enzyme dopamine beta hydroxylase, and this requires vitamin C as a cofactor. And now that we're thinking about it, do you remember what collagen abnormality results from a deficiency in vitamin C? There you go, that'd be scurvy. And how does scurvy present? There you go, you would see impaired wound healing, swollen gums and bruising, corkscrew hairs, perifollicular as well as subperiosteal hemorrhages, and hemarthrosis. And as we just stated, vitamin C is also used in the catecholamine synthesis pathway, where it's used as a cofactor to help convert dopamine into norepinephrine via dopamine beta hydroxylase. Now, in our final step here, norepinephrine is converted into epinephrine by phenylethylamine N-methyltransferase. And since this reaction adds a methyl group to norepinephrine, it should not be surprising that SAM is used as a cofactor to donate this methyl group. Now this enzyme is regulated by cortisol, so when cortisol levels are increased due to stress, more epinephrine will be produced. You may also want to keep in mind that both dopamine and norepinephrine are produced in the central nervous system as well as the peripheral tissue, but epinephrine is only produced in the medulla of the adrenal gland. Alright, now that we've spent all that time building some catecholamines, how do we break them down? Well, catecholamines can be broken down by our Pacman enzyme, which is monoamine oxidase, or MAO, or catech-O-methyltransferase, or COMT. Now dopamine is broken down by MAO, or COMT, into homovanillic acid. And norepinephrine is broken down into VMA, or velamandylic acid. And lastly, epinephrine is broken down into metanephrines. Now can you think of a tumor where we would test for these breakdown products? Great, that'd be a pheochromocytoma, which is a tumor of the adrenal medulla chromophene cells, which produce high amounts of catecholamines. And you can use lab values of these breakdown products to help diagnose a pheochromocytoma. And this disease will be discussed in more detail later on in our organ systems. And while we're on it, can you think of a few inhibitors of MAO and COMT? Great, your MAO inhibitors include selegiline and racegiline, as you see here, and a few of your COMT inhibitors include tolcapone and entacapone. Well, alright, since we're out of catecholamine coins, we're going to call it game over for the catecholamines. See you in the next video.